Hello, everyone. Welcome to our webinar, Confronting the Overdose Crisis, Is COVID-19 Fueling an Unprecedented Opioid Epidemic? We will be starting in about 120 seconds. So get your popcorn. Is it too early for popcorn? Are we allowed to have popcorn at 10:30 a.m.? Well, get your coffee, get your tea, your sugar-free Red Bull, because we're going to be talking to you about some very important topics today. For those of you that don't know me, I'm Andre Bailey. I'm the CEO of Project Opioid. Project Opioid is a leadership team based in Central Florida, working around Florida, bringing business leaders, faith leaders, other organizations, courageous elected officials together to battle what we're seeing as an unprecedented overdose crisis. So we're going to be starting in just a minute, in about 60 seconds. So go ahead and get comfortable. Get your phone all set up so you can like secret text. Is that, we put our phone during a Zoom and we do our kind of two things at once. I'm okay with it. If you're a double tasker, that's impressive. But those that you can go to the three task, that's the new Jedi level, is the three task. The watch something on a computer, participate in a Zoom, and text. So we're going to, again, thank you. Welcome to our webinar. We're going to get started in about 60 seconds. My team, are we good? Everything's good? Again, I'm Andre Bailey, talking today. Let's make sure everybody's muted. And we're going to get started in T-minus 60 seconds. All right. So let's go ahead and begin the webinar. Again, confronting the overdose crisis. I just want to start by telling you we're going to have all kinds of great guests today. So I'll point at the screen and have my team advance the slides here. So today's topic, again, the overdose crisis. I'm Andre Bailey. You guys know me already. Here's our guest speakers. We have two guest speakers. We have the Florida Attorney General, Ashley Moody, who's really been a champion on the overdose crisis and all of these issues. She led a task force that convened in April, right as the pandemic started, on the opioid crisis for the governor. So she's going to talk about that here today. We also have our friend from California, Harry Nelson, author of The United States of Opioids. Harry's one of the leading experts on the opioid crisis in America. Harry, we won't hold it against you from California. It's okay. We still love you. But he's going to talk about what nationally we're seeing in regards to the settlements and policy on a national level in regards to the opioid crisis. Next slide, please. Next slide, please. As always, if you have questions, well, actually, I'll stay here a second. Here's our special Q&A panelists. We'll have Brad Rex, CEO of eHome Group, Babette Hankey, President and CEO of Aspire Health Partners, one of the largest nonprofits doing behavioral health in the United States. Allison Walsh, who's the VP of Advanced Recovery Systems in all over America with programs that help those who are struggling with addiction and overdose. As always, we have questions. Pull that slide up. We have questions that people can put in the chat box. Let's put that slide up. There we go. Oh, wrong direction there. There we go. Well, trust me, we have Q&A. We have Q&A that you can put in the chat box. So we obviously have some slide issues, but it would not be a good webinar without some technical difficulties. So let's go ahead and bring up what is Project Opioid. I just want to show you this. I want to say thank you to our sponsors, our webinar and partner sponsors. I don't want to get into all of them, but we have so many great business partners who are working with us at Project Opioid. Project Opioid, next slide, really works for leaders working together in a collaborative to do advocacy and move the issue of the opioid crisis forward. So we are expanding around Florida. You're going to be hearing more information about the new Project Opioid collaboratives in Jacksonville, West Palm Beach, Tampa, Miami, St. Pete, and others starting in January 2021, because this is an important issue and we believe that the business, faith, communities, and others have to come together to help those working on this. Next slide. There we go. This is the slide I was referring to. If you have questions, go ahead and put them in the chat box. We're going to have leaders who answer those questions later. And again, if you need to email us, you can email us questions as well. Next slide, please. So without further ado, I want to introduce the Attorney General of Florida, Ashley Moody. Ashley, again, such a champion on this opioid crisis. As many of you know, what we do in local communities in so many ways is dependent on leadership at the top, at the state level. So we're privileged to have Ashley Moody here with us. Attorney General, are you there? Can you hear me?
I'm here.
Wonderful. Welcome to the webinar and take it away.
Good morning. Thank you, Andre. And this is really just warms my heart to see so many people gathered together using technology, that the pandemic has not in any way dampened your resolve as a group and as a community to fight what really has just ravaged our state and other states across the nation. In fact, I know many of you know that the U.S. Surgeon General and the Florida Surgeon General have declared this a health emergency, a crisis, and just seeing your 3-county group come together from all facets, not just lawmakers, state leaders, community leaders, and government, but businesses, the medical community. I mean, this is what it will take to make successful inroads in this effort. And this is really, as someone who, as a former federal prosecutor that handled these cases and saw what it did to communities, as a judge for over a decade that watched the criminal justice system affected, families devastated, really, and many of you I've met over the last 3 years, really one of the driving forces behind me deciding to leave my predictable job. I would say some thought I might be a little bit crazy to leave my job as a judge to run for the Attorney General was because of what I was seeing in our communities. And I knew that bringing together groups like this to address ways that we could have a positive change was absolutely necessary. And so thank you, Andre, for your resolve and your determination and your enthusiasm that has not been dampened one bit from the pandemic that is challenging all of us around the state. Really inspiring for me this morning to see. As many of you know, as soon as I was elected, even before I took office, I launched a working group. So proud of Seminole's own Sheriff Dennis Lima, who agreed to spearhead that. And we immediately decided within that group that this could not be something that we could do on our own. We needed a statewide group of experts to assess the situation, give recommendations. And so thankfully, our Governor DeSantis, heard our pleas and formulated a statewide working group on the opioid epidemic, which I was able to chair. We met in all parts of the state last year, heard from numerous experts around the industry, and released a report right when the pandemic started affecting our communities. And as many of you know, the pandemic has exacerbated the opioid epidemic, and we're seeing higher rates of non-fatal drug overdoses as well as overdoses. I think we've seen a rise of 33% from August of 2019 to August of 2020. It truly is heartbreaking to see how this affects our families. I remain committed to helping you and your community efforts. I hope that you will call on me. But this is not just a problem that government can fix, and I commend you. And I commend you for recognizing this has to be an all hands on deck approach. I commend Senator Perry and Representative Plakin, who were successful in getting legislation passed at point of care to discuss alternatives to opioid prior to their prescribing. I've personally met with medical school deans about educating our doctors on alternatives to opioids. As we know, a lifelong addiction can stem from a prescription. I've also met with other doctors and those that are related to the prescribing and use of opioids to make sure they understood We have a statewide resource now. We've set that up within my office called doseofrealityflorida.com. I'm hopeful that your team will work with us. We can partner. We've already partnered with 211 to ensure that communities know where to go, know where to turn. It has information on there for use from groups such as doctors all the way to schools and business leaders. And so I know we have a lot of business leaders on today. Understand that you can be just a part of this solution as anyone in elected office. And I see that you are, that you can use Dose of Reality Florida as a resource. There are printable signs, brochures, things that you can post in certain public areas that will raise awareness about the dangers of the use of opioids. We will not let up. We are training prosecutors. We've already done so on how to be more successful in prosecutions within the provider industry, the sober home industry. We're going to also focus on successful prosecutions and going after those that are peddling these things to the most vulnerable in our communities, especially when an overdose relates, and focusing on the maximum charges that we can bring. We're never ever going to stop examining ways that we can tackle this thing. And I commend you for routinely meeting, examining ways that we can be better, new ideas. I hope that you will bring them to me if there's any way that I can be helpful in your efforts. Again, thank you to all of those that are involved from the 3 counties. I look forward, Andre, to your statement on how the success of this group, the synergy from bringing everyone together in our faith-based business, governmental entities to work together. I look forward to taking that synergy, taking that example, that model, spreading it out throughout the state, using economy of scale, using what you have learned, what's been successful for you, and applying that in other areas. We appreciate your novel and timely efforts, and I commend you for keeping up the energy and the focus and the determination during the pandemic. Thanks for having me, Andre.
Thank you, Attorney General. If you're still there, one quick question as you go. 2021, everyone's looking at the recommendations that the task force put together. They're looking at what could be a challenging economic year. We come off an election. If I handed you a magic wand, Attorney General, and said, on this opioid crisis, here's a couple things you hope to see happen next year and beyond, what would you say to leaders, that magic wand you would see happen in our state on this opioid crisis?
That's a great question. And there, obviously, there's not one answer that's going to fix this. But what I've really been focused on, in addition to what you would expect me to be focused on as the top cop, working with our prosecutors, working with law enforcement around the state to go after those that are pushing, whether it's fentanyl, carfentanil, into our communities that are deadly and killing people. The supply is an issue, yes, and I will continue to focus on that. But one of the things I routinely see as I'm meeting with groups around the state, and I've met with groups like yours in different areas and families that have been affected by this crisis, and understanding where they can go to get help for their loved ones or personally, where they can go and how it fits with their income situation, whether or not they're going to be covered by insurance, whether or not it's a service that can be provided to them without insurance. The ease of a referral when help is needed is so important. So important. And so that's why we launched Dose of Reality Florida. We're trying to do what we can do. I'm working with other agencies to examine how we can have providers, have recovery service providers as soon as they have the ability, space available, as soon as they have a bed, funneling that information to a place where the public and providers can go to readily. I think that would help immensely. And so we've been having those conversations all year. In addition to all of the other recommendations in the report, certainly we will focus on those. But I think that would be a huge help to all of us, whether you are in business, government, whatever your organization, if you could go straight to a ready source of where there's available bed based on financial circumstances, that would help our state.
Florida Attorney General Ashley Moody, thank you so much for joining us. We're going to put Dose of Reality, for those who haven't seen it, in the chat box and in some of our follow-up emails. We're also going to include your April recommendations. If you have not read the recommendations that the task force that the Attorney General put out. You got to read them. They lay out, in my opinion, a blueprint for where this state needs to go in 2020, 2021 and beyond. Attorney General, thank you so much for joining us.
Thank you for having me. Keep up the passion and the great work.
Thank you. Florida Attorney General Ashley Moody. For those of you that want to get in contact with her and her team, we'll give you their information if you don't have it. You heard it from her. I loved her comments there at the end. We need to look at enforcement of the law. We need to look at getting the word out about this crisis, but we also need to examine, when someone's in need, how can communities work with that person? Our response to the opioid crisis is as good as it works with one person in every community in our state. So thank you so much again, Attorney General Moody. Let's go to our poll question. We have a poll question, and we're going to talk for a second about this overdose crisis. A poll question, and you can answer this right in your Zoom. What is driving the overdose crisis in 2020? Is it economic uncertainty, lack of access to treatment, mental health, all of the above? So answer that poll question. We'll give you the results in just a minute. Before we get to Harry Nelson, I'm going to talk for a second about some of the new data that we're seeing. This is very important. I don't have a slide that says this, but I almost want you to sear this in your brain and write this down. We're going to share data with you. Don't let yourself get data dumbed in the next few minutes. And let me tell you what data dumbed is. And by the way, I just made that up. So if you Google it, you're not going to find it. Data dumbed is where you get data dumbed down at times, where numbers, because they're so big, don't mean anything to you. And we do this on a lot of different issues. But I want to give you an example, though, so you're with me when I start sharing this data. I'm going to share you the numbers on this overdose crisis, what we're seeing around America, what we're seeing in Florida, some preliminary numbers we're going to share with you right now. But take a second to think about this. I want you, if you're sitting at your desk, take a pen, and no one else is going to see this. It's all private. I want you to write down the amount of money you make at your job right now, whatever it is, whatever you make a year, you put on your taxes. Just write that number down. Okay. You wrote it down? All right. Now take your calculator and increase that, because I, again, have the magic wand back from the Attorney General. I'm going to wave that magic wand and give you a 5% raise. Would that be exciting? Like I think that would be pretty cool to get a 5% raise. Now hold that number, kind of write that number. Now, what if, though, as me, as the magic wand boss of your life and world, what if instead of a 5% raise, I gave you a 50% raise? Wouldn't that be significantly different? Wouldn't that alter? Are they both raises, or is one good and the other is life-changing, right? This is what I'm talking about. Data and percentage changes, if we're not careful, we get lost in the numbers and we don't realize what they really mean and through a lens of common sense. So here's what you need to know about this overdose crisis as we go to hear from our friend Harry Nelson. Number one, know this: the opioid crisis was increasing again already in 2019 before the pandemic hit. So remember, data comes in a little late on something like the opioid crisis. And so what we just learned in the last few months is that the opioid crisis from 2015 to 2017, where we were seeing skyrocketing numbers. But in 2018, we actually saw for the first time a diminished number. We saw the opioid crisis nationally in Florida. We saw the numbers go down of overdoses and deaths. And it was great. And we were all hoping that that would last. And we were celebrating what we thought was real progress. But we saw, even as the data came out in the last few months, that in 2019, that after a brief drop in 2018, the death rate in 2019 back up almost 5% across America and back up in Florida. So just keep that in mind. Next slide, please. But as we now move into, this is the big takeaway. Every webinar, we give you a few slides. I want you to screenshot this. I want you to send this to your friends. I want you to put this on social media. Big webinar takeaway number one. Now that we're in 2020, overdoses are skyrocketing, driven by opioids and other synthetic opioids and polysubstances at record numbers. Go back to the 5% versus 50% raise. How would you like to get a 5% raise? How would you feel about that? How would you feel about a 50% increase? Now apply this to this slide as we go to the next slide. But we're going to send you these slides. And we start talking just for a minute about 2020. How many of you remember March 11th of 2020? I remember where I was at. I was out at a dinner meeting in a public establishment, and this was a big day. I'm trying to get your head around when COVID-19 began to hit, because I'm going to show you some numbers that show drastic increases of overdoses, both here in Florida and across America, that really coincide, you got to see this, with the lockdowns, the shutdowns, the stress that all of us felt because of an unprecedented COVID novel virus that hit us. But on March 11th, you remember, it started with big expos being canceled. March Madness said that there's going to be no fans. European flights were banned. And then I remember being at a restaurant and hearing that Tom Hanks and Rita Wilson, for whatever reason, we were really thinking about this virus. Forrest Gump gets COVID and we all take it serious. I'm telling you, I remember that so specifically. Then the NBA, just a few minutes later, test 2 players positive, cancel their season. And then suddenly we start as a society around America and in Florida, we start seeing lockdowns next and shutdowns and pullbacks. Next slide, please. And this is kind of a timeline. We'll send you guys these, but this is a timeline of how, then we moved to March 18th and we had 9,000 cases. You move just a few weeks forward and the shutdowns and lockdowns begin. The reason this is important is because I'm going to now show you data that coincides with this, because when we look at the timeline of lockdowns and disruptions, we can see, next slide, please. This is brand new data that's coming out in the state of Florida. I'm going to ask your forgiveness in advance. This is preliminary data, but we wanted to share it. The Department of Health wanted us to share it. The governor was talking about these stats, even from a preliminary standpoint, just this week. But what we saw is as this opioid crisis was progressing, and as lockdowns and shutdowns, down here is March 20th, April 20th, you saw an absolute unprecedented increase in overdoses and overdose deaths. Dr. Kendall Ward is off screen. You can't see her right now. But in the month, Dr. Ward, what was the increase?
In the highest month between May of 2019 and May of 2020, there was approximately a 60% increase.
All right. So thank you, Dr. Ward. She's on the Zoom. Trust me, it's not just a voice from heaven talking. But year over year, we saw a 60% increase from the month of May 2019 to the month of May 2020 in overdose deaths.
Correct.
60% increase. 60%. There is no precedent for that. There is nothing that we've ever seen like that. And these numbers, we're going to be releasing a report on these numbers sometime this week. We're just wanting to double check some of them in concert with the Department of Health. But what we're seeing is that as the lockdowns, shutdowns, the anxiety, the mental trauma hit our society, along with the shutdowns, we saw people die of overdose in amounts we've never seen in American or Florida history. Next slide, please. This is another slide showing a trend in non-fatal overdoses. You see January 2019, you see Narcan. When you start thinking about non-fatal drug overdoses, Narcan is usually involved. But look at the spike right in April, May, and then in July. And so you're seeing, again, overdoses, even non-fatal overdoses, increase 30, 40, 50% in communities around Florida. So, we are absolutely astonished by these numbers, and they should scare all of us. So as our webinar started out, is there a COVID-induced overdose crisis? There absolutely is. And these numbers should frighten us, and they're staggering. Next slide, please. This is just a couple of articles from around America. This data is just coming in. Some of these articles are as recent as just the last week. But overdoses in Philadelphia up 16%. Now watch this. This is where I don't want to say fake news, because we don't talk politics here. But I'm just telling you, this article here to your left. We'll put this article in the chat box. It basically says that overdoses in Philadelphia were up were up in the January, February, March by 16%. But they're then only really counting the 2 weeks, because we only locked down for the second part of March. So 2 weeks drove that increase in that part of the country. You look at Portland, Oregon, the Oregon Health Authority reported a 70% increase in overdoses. So people are overdosing and dying around America in record numbers. We're not going to get deep into this right now, but I think, we're not here to say that the lockdowns and the quarantines were wrong. We're not here to say that. What we are here to say, though, in hindsight, I'm not going to dive deep into this, but please hear what I'm about to say. In hindsight, when we quarantined, when we went into lockdowns, when hospitals were forced to divert a lot of resources towards preparing for the coronavirus, as they should have, and when behavioral health centers, many of them had to close, many in-person recovery centers had to close, methadone clinics, it became very hard to get treatment when treatment was already difficult before COVID, and you saw people die in record numbers. The reason this is so important, guys, is because if COVID begins to have a resurgence around America, here in Florida, no matter whether or not the governor and others impose new lockdowns or not, that's way above my pay grade. But if we start seeing it become harder again for folks to get into treatment, to get help, to go to their doctor, people are going to continue to die in record numbers. So very important. Next slide, please. By the way, our poll question came in. I'll talk about this. 90% of you said in the poll question that it was all of the above. 90% said all of the above was driving this crisis. This slide, you will send it to you, but again, Oregon, 70%. State of Kentucky, 50% increase. 50%, unprecedented. And then when you look at the overdoses in Florida, the numbers are preliminary. We heard the governor talking 2 days ago. He was here in Central Florida talking about a 60% increase. We're going to have a full report for you out very soon. Just know that the numbers are completely staggering and frightening around both overdoses and deaths. Next slide, please. So again, lots of questions. I'm sure you have lots of questions. Please continue to put those in the chat box. We're going to have a Q&A later. Brad, Rex, Allison Walsh, Babette Henke, and our friend, the friend of Project Opioids, Harry Nelson. Next slide, please. So I want to go ahead and introduce now. Harry, can you hear me? Whenever you're introducing a guest, you always have the mute and unmute moment.
I'm on. If you can hear me, I can hear you.
Awesome. Well, Harry Nelson, if you don't know him, he is the author of The United States of Opioids. He's also the founding partner of Nelson Hardiman. He is a real attorney who knows about this opioid crisis. He consults with some of the biggest leaders in America, opioid crisis. Harry, talk to us. Thank you for joining us, by the way. It's a little early over there in California today.
No, not too bad. It's 8 a.m., but it's an honor to be with you, and really glad to support what Project Opioid is doing and to share some thoughts this morning.
Well, take us through why I love talking to you, Harry, is that you're great at telling us, we see Central Florida, we see Tampa, we see Miami, we see the state of Florida, but it's always good to get the national perspective. Tell us, because you're a person with your finger to the pulse of this opioid overdose crisis, what are you seeing? I presented a bunch of data that's all rolling in front of all of our eyes in real time. what are you seeing and what do you believe we need to be looking at? Harry Nelson, go ahead and take it away.
Sure. So, by the way, I have some slides. If you, Andre, I don't know if you want me to. I'm happy to start off, or if you want to put those up. But okay, perfect. Okay, good. So, yeah, what we're seeing, around the country, you the data you just alluded to it. This problem has been serious everywhere. It doesn't look the same in every community. There are certainly different factors. There are parts of the country that were hit earlier. The opioid crisis is complicated, right? That was one of the central things I tried to get across in the book, was that this is a complicated problem with a lot of different pieces to it, right? It's one of those problems that looks different depending on whether you're a parent or a family that has lost a child, whether you're in law enforcement, and whether you're at you're a physician or a health professional trying to deal with it in the addiction treatment world. This problem looks different from every side. The one thing we can say is that we are at the situation was a problem that was getting worse year over year, but we've never seen anything like the kind of worsening, particularly on the overdose death, overdoses in general, and overdose deaths. Thanks for putting that up. So what I thought, Andre, unless you have more questions, I'm happy to kind of spend the next couple of minutes.
Take it away, my friend.
Okay, perfect. I just wanted to spend a couple minutes and I'm not going to take too long, at a high level, to sort of just talk about some big issues. I wanted to just touch a little bit on there's been some big news in the last week on settlements. We're expecting much more in the weeks to come, how to think about it, and then just how to think about the problem, right? How the pandemic has changed the situation and kind of where we are. I see some familiar faces on the webinar from when I was with you in Florida for Project Opioid last fall, and there's some new things to say about it. So this is sort of the topics I wanted to go through. One of the things when I wrote the book, The United States of Opioids, I was really trying to get the conversation shifted to problem solving, and I'm really was thrilled to connect with Andre and find a like-minded person, because there's a lot of hand-wringing here, but really getting practical about what we're going to do about it is really what moves me. So let's start with the settlements. The first thing to talk about, last week we had a major advance. Purdue Pharma, which has sort of been identified as the catalyst of the opioid crisis, if you will, for its product OxyContin, which really was the driver of a spike in overdose deaths in 99, 2000, in the late 90s, and really beginning in the early 2000s, finally reached a settlement with the federal government. So it was an $8.34 billion number, which sounds like a lot, right? And there's a few things to say about the settlement, but there's a question about how much money we're going to see overall globally from the drug makers like Purdue, from the drug distributors like companies like McKesson and Cardinal Health, from large pharmacies. So, at the beginning, we were hearing that this might be $100 billion global settlement when we all get done. Then people started saying $50 billion. I'm personally thinking that we're going to see a pool of about $30, $40 billion. So this was a major event that Purdue reached the settlement. But the questions we have to ask are, how much of the money is coming? When is it coming? What are communities going to see? And will it make a difference? And if we can advance to the next slide, I wanted to just sort of talk about the process. We really have we have three different sort of major focal efforts in these lawsuits that are going on that are going to lead to settlements. One are the cases we saw settled last week with Purdue, is our federal efforts. And those are still going on in many, many states against many of these drug makers, drug distributors, and pharmacies. We also have state attorney generals, right, that are pursuing these cases, trying to get money into the states to deal with the problem. And we have a separate massive litigations taking place, what's called a multi-district litigation in Cleveland, Ohio, with over 2,400 cities and counties, representing a potential class of 25,000 plus cities and counties. So we have a lot of folks at the table trying to get their hands on this pool of money, which is still undefined, and looking at trying to get that money for a lot of different purposes, getting money into the health systems to actually do more overdose prevention, getting money into addiction treatment to take the problem on, getting money into law enforcement, which have been so important on the front line. We really seen law enforcement have to play a critical role of getting people into treatment, getting money into our school systems and into education to do more prevention work. So we have a lot of hands trying to get money, and this pool of money that's coming together. In the case of companies like Purdue, we don't even know really how much money is going to come now. The company's already in bankruptcy. We had another major opioid distributor, Mallinckrodt, go into bankruptcy a couple weeks ago. And we don't know how much money is coming now versus money out of future sales. Purdue Pharma is essentially turning itself into a nonprofit as part of this process to fund with other monies. What I can tell you is that the estimates of the money needed nationally exceed $2 trillion. And we're talking about a pool of money that I think is going to be between 30 and $50 billion when we get done. So this is a drop in the bucket.
Harry, let me just interject because we got to move on from this topic, and we're going to cover this in depth in future meetings. But really what people need to hear out there is when you start thinking about the amount of money and when that money is going to be needed for communities to address this opioid fueled overdose crisis, if the numbers come in at 50, 30 billion, Harry, it's not going to be anywhere close to enough. I think that's the point that everyone's trying to make. That's
the takeaway. We're not going to solve this with this money is not a panacea. It's not going to be a magic solution to the problem. So let's talk about the problem just a little bit. I want to go quicker here because Andre alluded to it in his numbers, but just to give you a perspective, we're always a year behind in the data. So last year, 2019, we got the 2018 data, and there was this whole question of how the opioid crisis was doing. On the left of this slide, I have, this is a slide that maybe people have seen before. It kind of alludes to the fact that the opioid crisis has really been three waves. Originally in the early 2000s, this began as a problem of prescribing OxyContin and other drugs. Then in the late 2000s, it became a problem of heroin. And then now we are in this fentanyl phase where illegal fentanyl and carfentanil, which Attorney General Moody alluded to, are driving the crisis. So the question was, is it getting worse and worse like that last upward curve? And in 2018, when we looked at in 2019, when we saw the 2018 data, we actually saw for the first time that drug deaths went down. At least prescription drug deaths and heroin drug deaths went down, not fentanyl deaths. But overall, there was a drop in the numbers, and people said, maybe we've actually got this opioid crisis beat. And there was some good news. We were getting a spread of medication-assisted treatment, drugs like buprenorphine, which were making it easier for people to detox successfully off opioids. And we were seeing the successful deployment of Narcan, so that if you administered the Narcan drug at the moment of overdose, before somebody's heart had stopped beating, you could rescue them. So we saw some good news. And that's where we were last year. Some people were saying, maybe we got this thing beat. But we now know that that's not the case. And if you want to advance the slide, what we saw in 2020, and this is before COVID, before the pandemic, we saw a 5% increase, which Andre alluded to. So we already knew before the pandemic that 2018 was an exception, that Narcan and medication-assisted treatment were helping, but this crisis is still going up on the back of the fentanyl problem. And then, as Andre shared a couple minutes ago in this just absolutely staggering data, we entered the pandemic, and we're now in a phase where we're not talking about single-digit increases in the overdose deaths. We're talking about these double-digit 40, 50, 60, 70 in different parts of the country, 70% increases. We're seeing this horrific skyrocketing effect.
And Harry, just so people can hear this from you, in the history of this crisis, we've never seen 20, 30, 40, 50% increases in 1 year. Never.
No, we've been seeing single-digit increases year over year. The opioid crisis, in contrast to COVID, with 220,000 deaths in the last 7 months, this has been a slow-moving mass casualty event. Meaning, every year we see an increase, rarely hitting over 10%, usually increasing 5 to 10%, and it's been the cumulative effect over 20 years of opioid deaths that we finally woke up to the horror of the problem. So seeing a single year numbers like these it has been unbelievable. And there's a big question about, is that going to sustain? We have to believe that the numbers are going to normalize at some point, which brings us to the next question, which is really what's driving this crisis. So one of the things I tried to argue in the book, a lot of people, one of my frustrations was when we talk about the crisis only in terms of Narcan and medication-assisted treatment and not really spend time on the drivers of the crisis, we're looking at the problem, the roots of the problem too narrowly, and it drives us to think about the solutions too narrowly. And the way that one of the things that I tried to argue in the book, and I think we can really use the pandemic to see the beginnings of this really coming together, the question is what's actually driving this unprecedented skyrocketing in the problem. And I would argue that we have these underlying drivers, right? That if you look at the data on the level of anxiety and depression and other and mental health symptoms being felt, literally, according to Kaiser Family Foundation, in the last 6 months, a majority of the population is reporting symptoms of these problems. And we are seeing a profound level of isolation and despair. These were problems in parts of American life for many people before the pandemic. They are now broad problems, and they are driving these related mental health crises. And then the question is, on a deeper level, what are the other pieces of this that are driving the long-term picture? Some people, and I'm not gonna, we don't have time on this webinar to get into what the roots are, but I put these as questions. But how much is the unemployment crisis and this skyrocketing loss of work and everything that goes with that, the implications of not having a job, how much is that driving the problem? How much is the disconnection and the intensive time on technology, how much is that driving the problem? How much is this a spiritual crisis? How much is the divisiveness of our era driving this? I'm not going to answer the question, but I'm going to put it out there as a question. I think the real getting to solutions means really understanding how these issues tie into the opioid crisis. So if we can move forward, I just wanted to, and we can pass the slide. We really are just at a point of massive need for people. And one of the things that's important to note is that we have a lot of different people at different phases. We have a huge number of people who are just at risk, right? We have kids. We have people who don't have a problem yet, but are at risk of having one. We have people who are in the beginning of one, who have developed an addiction. And then we have people who are really at risk of overdose themselves. And then, of course, all the collateral damage, the kids who are growing up with parents who aren't present because of addiction, the kids who are being born, the moms who are carrying children with opioid addiction. This is a massive problem from a public health standpoint. So we need new solutions, and there is some good news in the health system world. One of the things that we saw in the pandemic is a massive expansion of telehealth and getting access to care. A lot of the problem here has been people just not being able to get the care that they need. We saw one of the interesting facets of the opioid crisis is people who came out of prisons and then didn't have access to resources. So telehealth has been positive. We have this new this technique that we're spreading out of having a brief screening for a risk at every point in the system, in our health system, brief intervention and referral to treatment, more peer coaching, having people who have had the experience, putting them to work in our system. We're seeing new therapeutics, and there are positive steps being taken in our health system. But if we could advance to the next slide, the message I want to leave you with, and I think this is a message that really resonates with Project Opioid, is that the health system is just not going to be enough. This is much more than a problem that our health system can solve, and it's much more than one that we're going to have settlement dollars to solve. So that what we really need to do is look at community partnership models and find ways to coordinate the efforts, the data and the efforts of government, the health system, law enforcement, faith communities, the business community, educational institutions, nonprofits. We really are the only way we're going to address this is if we really start thinking broadly about the problem and broadly about where we're going to find the solutions.
Harry, as we go to your last slide, Kendall, pull this up, his last slide with the blue boxes. I think some people might hear the word coordination or collaboration, and I think they might get the wrong idea, because sometimes we use these terms and they lose their meaning. If we're wanting to have a chili cook-off for our local church, we might have a coordinated group of people to put that together. But this is not the kind of collaboration and broader approach we're talking about. When we start looking at these blue boxes on the screen, aligning cross-sector leaders, data, What we're really talking about is creating massive policy change and resources at state and federal levels that then can be implemented in communities. And so it's incredibly important, and I'll just let you address this, and then we'll thank you for your time and have you back in person in our next conference. But I will say, Harry, how important is it that collaboration amongst leaders that have some chutzpah, that can make it happen? How important is it that those leaders push for policy changes and resources for this crisis? Or putting it one different way, I'll put words in your mouth. Aren't communities somewhat, aren't their hands tied if we don't have state and federal policy changes and resources?
We need it all. We need the policy changes, but and I think the message has to be we're not gonna really make the headway we need unless we start to, we see not only the policy changes, but we see deep engagement on a cross-sector basis, and really a feeling of accountability that goes across policy and into action, and we all have to take some measure of responsibility, or we're not going to have any hope of doing anything about this crazy situation.
Harry Nelson is the author of the United States of Opioids. Harry, finish your thought. I just cut you off. Forgive me.
No, it's no. I think you got the idea. It's it's funny. I just the very last thought I'll share with you is I've been going around the country and before the pandemic stopped travel and talking about the opioid crisis, and it was very interesting to me when we hit the pandemic in March. The conversation, nobody wanted to talk about opioids. And I do think, by the way, I think opioids are a stand-in. This is an important point. We got some data in 2018 that showed that if you actually go back 45 years, you go back to the 70s, you see that in America every year before opioids, we had a year-over-year exponential increase in the number of drug overdose deaths. And that actually preceded opioids. Opioids just have covered the last 20 plus years of it and have made it much, much worse than it was before. But this is a big problem. And so nobody wanted to talk about it at the beginning of the pandemic. We had a new, bigger public health crisis. And I actually, what we're really seeing is it all ties together, and we're not going to be able to get through this pandemic with the health of America intact and do the work we need to do unless we start thinking in a comprehensive way about how to address it. It's really, unfortunately, our worst nightmares are coming to bear, and we need to put this back on the list as a priority.
Harry Nelson, author of the United States of Opioids. If you are one of our leaders and you don't have this book, I think we still have some copies. I can get you a free copy until we run out. So put that in the chat box. You should read this book. And as you go, Harry, I just want you to think about one thing that we should explore together in the next few weeks and few months. If you look at the overall COVID death number in America, that 220,000 number, which is absolutely a tragedy. Since 1918 and the Spanish flu, we haven't seen anything like it. But if you start breaking that number down by age, what you see, and you start adding what we now see are the increases in deaths around America from overdose. What I think we're going to see is, and go to this next slide, and Harry, I'm going to let you off the hook here. Next slide. What you're going to begin to see is that we have, and this is the second big takeaway. We're gonna get to our Q&A and get you out of here. So Harry, don't go away yet. What you're going to see is that COVID-19 has created an epidemic within a pandemic. Let me say that again. COVID-19 has created an epidemic within a pandemic. So what Harry is saying is 40 years ago, even before opioids, you saw this deterioration of the American psyche, of mental health issues began to grow, anxiety, depression. You then saw, as opioids and other drugs came onto the scene in greater numbers, that overdoses began to increase. And then 2020, you saw an absolute collision between our mental health drivers and this opioid overdose epidemic and COVID-19, which I think the numbers are going to bear out that the amount of people dying under 40 years old for overdose far exceeds the number of people dying from COVID-19, the virus right now. The number of people who are under 40 years old right now in 2020 of overdose far exceeds the number of people dying. And so we've sent this message to young people, whether we meant to or not, that they're really not that in danger of COVID-19. Wear your mask, don't be a jerk, and obviously that message doesn't always get out. But the message we're not sending to them is that this is a lot of those under 40, especially in our community and in our state. They are at greater risk of dying of overdose than ever before in American history. An epidemic inside of a pandemic. Harry, stay on there. We're going to now move on to our question and answer session in our last 10 minutes. Let me introduce Brad Rex, CEO, eHome Counseling Group, Babette Henke, President and CEO, Aspire Health Partners, huge behavioral health group located in Central Florida, serving a lot of communities. Allison Walsh runs Advanced Recovery Systems. So we're going to dive in. I'm going to move around, ask some questions, and then we're going to open you guys up one at a time as I ask these questions. Next slide, please. And please continue to send questions. We only have time for a few of them. Question number 1. I'm going to go ahead and key up Brad Rex. Brad, how you doing, by the way? Good to see you, my friend.
Good. How you doing, Andrew?
Good. How can the current system accommodate so many people that need treatment? And let me just preface that question by saying, I think most people would say it was hard to get treatment before COVID. Now, with the numbers we're seeing, Brad, what in the world do we do?
Well, Andre, it's a great question. And, Harry talked about telehealth. My company is a national provider of telebehavioral health services. And so we have been able to see what's been going on across the country. If you look at Florida specifically, there's 636,000 people who have opioid use disorder. And we know that only 26% of the people with opioid use disorder have been able to get treatment nationally. So that means there's 500,000 people in Florida alone that need treatment that can't get it. And we also know that there's 26 out of the 67 counties in Florida who have less than 10 doctors that can prescribe medication-assisted treatment. 22 of the 67 counties have less than 10 mental health professionals. So you're now talking about a third of the people in our state don't even have access to treatment if they wanted it.
So Brad, a quick follow-up here. When you start seeing these numbers of deaths, and these are preliminary numbers, but I'm telling you, I like to encourage people when you're sharing them, they're preliminary, but they're going to hold up. I want you to know that. Brad, when you see those numbers, and then now you combine that with what you're sharing, this is not totally surprising to you then?
Not at all. And certainly we've been seeing it in our company with the dramatic increases in the number of people seeking help. But the interesting thing is we've got a solution here. We have got a solution to treat the people who are currently not getting treated, and that's treating them virtually. We can reach anyone, anywhere in the state of Florida, or even across the country with virtual treatment. We can prescribe for them with life-saving buprenorphine and other addiction treatment drugs remotely, and we can also provide all their counseling remotely. And virtual counseling has been proven effective. Hazelton Betty Ford is one of the leading companies in the world in addiction treatment. They just published a report that said that virtual addiction treatment is as or more effective than in-person treatment. So we can reach all the people who need help right now. We just need to do it virtually.
Yeah, so one of the big takeaways for those of you listening, and as we move on to our next question is, again, I want you guys to hear this and hear me, hear my heart here. What is obvious is that we shut down our state, our society, to prepare for the COVID, the novel coronavirus, COVID-19, and we had never done that. There was no playbook on it. And so services in various ways were no longer available to people struggling with addiction, people struggling with opioids, people who were struggling with all types of substances, and people died in massive amounts. And I'm only saying that though, because we don't have a time machine. But if coronavirus, I don't know if anyone's keeping up with current events here, but if coronavirus surges back across America, some of you are on this webinar from around America, or it surges in Florida, even if we don't put mandatory lockdowns again, you're going to see disruptions. People will naturally be afraid. But what Brad is saying is that there's a mandate right now, a moral mandate to stand telehealth up at a level that we've never done before, even, increased beyond the pandemic. And Brad, it's so important that we get that message out there. Let me pivot to question number 2. And this is for Babette Hankey. Babette, are you there? Does the technology serve us well? Are you there? Babette, are you there? We have a question for Babette. And the question is, what are the critical components that a community needs to address to keep people who are suffering from overdose? Babette, are you there?
I'm unmuted now. I was waiting for the unmute. Thank
That's
you very
all right.
much. Great question.
You got to have a mute moment or the webinar
Right,
is not
absolutely. So when you look at the disease of addiction, coupled with what we're dealing with COVID, the social unrest, as well as the divisiveness of the elections, we are faced with a multifaceted, unprecedented crisis. That's what we have today. When we look at what we need to do to be able to address this so that we can help people who have opioid addiction and stop the overdoses, we need to really look at parity. When you look at any other disease in our system, diabetes, heart disease, and cancers, there's not limitations on those services or medical services that an individual can receive. However, when you look at our disease of addiction, coupled with what we're talking about for mental health, there are limitations on the services and the reimbursements of which people can receive. That's number one. The other thing we need to look at is a paradigm shift. We've heard from the Attorney General, we heard from Andre, we've heard also from Harry that we're faced with a very different issue today. When we look at the issue today, we have the co-occurring issues and we have the absolute needs for people to have their basic living needs met. To do that, we have to make sure the medical components to treat addiction are there, but we also have to bring in the case management and care management for these individuals like we've never had to do before. And finally, I would attest that we also need to maintain the flexibilities that have been put into place. Mayor Demings, as well as Department of Children and Families, Agency for Healthcare Administration, have put in flexibilities for those who have addiction disorders and mental health disorders to be able to continue to receive the telehealth Brad talks about, as well as other evidence-based programming with no limitations. However, those end December 31st. We have made great strides in the field and in this space by reducing the number of no-show rates, increasing the engagement, and having greater access for individuals. That needs to stay in place.
Babette, thank you so much. I want to pivot for the sake of time to question 3. Harry, you still there, man? Or
I'm here.
So you already answered this question. So, but I do want to come back to it and just give people one more part on the question 3 is how will the settlement from the Purdue Pharma case impact? I don't think we're seeing the right slide. How will the Purdue Pharma case impact the ability to get help? I think what people, Harry, what they need to hear, and what I want to just reiterate is, I think you have to take this into 2 parts. You have to take it into you have to take it from a justice part, right? Like, we want to see justice, and we want to make sure justice is served on these drug companies, on the Sackler family. If they're able to embezzle $8 or $10 billion and hold that money, which I don't think they will, that would be a travesty. So there's the justice piece. We want to see justice happen. But I think the bigger point, Harry, and just reiterating it, is those communities or states or the federal government, if they think they're going to be able to use the opioid settlement money to solve this crisis in 2021, they are mistaken. Do you agree?
Yeah. I agree. Look, you just have to do the math. I mean, we're talking, the latest numbers I've seen are estimates of 2.2 trillion is really the cost nationally of a solution. So we're talking about a settlement that amounts to pennies on the dollar. And I think the important thing to remember here is also that we can definitely hold the drug companies accountable for fueling this. But the bottom line is the problem that we're seeing today with fentanyl is not a drug company problem. It's a much bigger one. We're not going to solve it that way. If I can, by the way, Andre, if I can say a quick word, one of the questions, the very first question that came up, the way I think I would encourage people to think about how we're going to solve this crisis in terms of the number of people who need help is really, our treatment of addiction and our mental health treatment in this country is catching up. It has a long way to go to catch up to how we think about the other kind of major diseases facing America, to heart disease, to diabetes. And we're going to need to really put the emphasis on catching these at an earlier stage, because that's the only way we're possibly going to have enough money in the system to treat everybody. We've got to recognize these problems are really broad and really start thinking about how do we start treating them earlier. And there's still going to be plenty of people, like that we have plenty of people who need diabetes, who need dialysis today. We're going to have plenty of people who need late stage treatment, but we've got to think about what early stage treatment looks like. And to me, that's the part of the puzzle that we have barely begun to scratch the surface of.
Thank you, Harry Nelson. We are at 11:30, so I know some of you are going to have to log off, but I love this virtual meeting because in a normal meeting, I'd feel pressure to not run over. But guess what? It's 11:30. If you got to go, love you. See you soon. But we're going to take 5 more minutes and keep going. And if you want to stay, please stay. So Allison Walsh, question 4. Someone is asking this very specific and personal question. What if someone in my company needs help? We're talking about this opioid overdose crisis in terms of data and systems change. But how does this relate to an actual person out there in need right now, Allison? What can people do?
Absolutely. Well, and I think Harry really teed this up nicely. The fact that so many people need to be doing more proactively. We need to be screening. We need to be being just as proactive with our mental health as we are with our physical health, and doing the checkup from the neck up. We did a survey over this time. We pulled 1,000 parents to see how their kids were doing, right? And 60% of them said that their children were experiencing signs of mental health issues, anxiety, depression, and 85% of them said they had never experienced them before. So not only are adults struggling with this, kids are struggling with this, young adults who are extremely at risk for overdose are struggling with this, and we've continued to see those numbers rise. And so what we try to do on a daily basis is really advocate for people to take care of themselves mentally as well. Have the screening tools in place. You can we've created some of those screenings that are available on our site. You can go to swellhub.com and screen yourself monthly. Make it a routine. Set an alert on your phone so that you're monitoring how you're feeling inside as well, and get help sooner rather than later. The acuity and the chronicity of the patients that we're seeing, they've waited way too long, and we don't have to do that, right? There are resources out there. We've talked extensively today about telehealth. It's as easy as logging on and requesting an appointment. And I encourage people to do that. I also encourage employers to make sure that they have appropriate resources in place, that any organization that interfaces with the community to have a list of resources. We're happy to supply them as well. We can come up with community resource lists for days, right? As far as where to turn people for help. And that's critically important, because sometimes people only ask once, and sometimes they only gain that courage once. And it's our responsibility to make sure that we can appropriately and responsibly connect them with services in their communities. And they need to take those steps, and they need to be supported in the process and not feel ashamed or that they shouldn't come forward, because every single day that you don't get help, you're digging your hole deeper, and we have to do something about it now.
Yeah, for those of you, again, we're going to be wrapping up in just a couple minutes. For those of you that need information on Allison's organization, Brad Rex, his organization, eHome Counseling, Advanced Recovery, Babette's organization, Aspire, Dose of Reality, we're going to put all those in a follow-up email that we get to you by the end of the day today. We want you to have those and other resources. We didn't get a chance, panel, to talk about this, and I'm so bummed, but we need to address, you guys have drilled this into my head, so I can't let us go without this. Parity or our inability. There are a lot of people out there who are going to seek help, and because of all kinds of reasons, lack of insurance, other challenges, they are not going to get the help they need. If you're still there, Babette, are you still there? Brad, are you still there?
I am.
Babette, talk about that for 1 second. We're going to get off here. I promise you I'm going to end this webinar. I'm going over, but what is it that we need to address as far as an inequality in people's ability to get help if they need it?
Critically important. One of my first points is we have to be able to have the resources and the accessibility for people. Andre, you talked about, we're all getting a 50% increase. So everybody knows about the ATM. We take that 50% increase and we go to ATM. let's think about it in terms of addiction and mental health and co-occurring disorders. If we look at from an ATM standpoint, we need to ensure that parity creates and that we have it so people can have A, accessibility, T, timely services, and M, services that are meaningful. If we can make sure that those are meaningful evidence-based services that are timely, when somebody needs that service, they get that service either through a telehealth means or through a audio means, video or audio, and or from a open access appointment, as well as then moving into accessibility, having all of those services available to meet the needs of those individuals. In our state, we are already very underfunded before even this pandemic hit for mental health and substance abuse. So looking at being underfunded with potential state reductions, as well as moving into where we're not already at parity, it needs to really be one of the number one priorities for our field and our businesses and our communities.
Babette, thank you so much. As we close, I just want to show you a couple final slides. We're going to get you all these resources. Next slide, please. All right, big takeaway number 3. It's going to take a historic leadership work together to solve this overdose crisis. Next slide, please. A few takeaways for you to think about. Communities need to expand options, as Babette was just saying, for those in need. Know this, there are people reaching out for help, not getting help. We need to work on that together. Next slide, please. Let's keep talking about Narcan, MAT, medicines that can save lives, expanded mental health services, advocacy, and leadership. Those are critically important. Next slide, please. Expanding access, treatment, recovery. We'll send you these slides. We got to get a game plan on this. Next slide. State leadership will make or break this crisis. If I can get away with it, next slide. I don't know if you know this. There's an election coming up. You probably haven't heard. It probably hasn't been on any of your social media or television. So this guy is taking on this guy. And so my point is, whoever wins, President blank must respond to crisis. We are going to need an amount of money on the mental health and overdose crisis that we've never seen before. So next slide. And then our local state leaders, we need to continue to partner with them. And we need to humanize this crisis as we go. Final slide, next slide. So many young people are struggling. Next slide, we need to continue to help get the word out. Remember, this is Cody. Cody is someone we talked about. Those numbers that we shared, X hundred in your community, thousands of people overdosing. Those aren't numbers, those are real. That's someone's kid, that's someone's brother, that's someone's parent who is not alive today, who could be alive if we could have got them help. And so thank you for joining our webinar. If you attended and you want to get involved with Project Opioid, we are now all over Florida. We want to get you involved. Thank you so much. Thank you to our leaders. Thank you to all of our guests and panelists. I'm Andre Bailey. We hope that you join us on the front lines of meeting needs and saving lives. We'll see you soon.